When radiologist resident Dr. Joshua Clayton got his test results back from a popular DNA testing kit, he says he didn't think much of them.
They were all negative and everything was fine.
Until he got a kit for his dad.
I got one for him as a gift. He did some extra research and found this other service, and for $5 thought it was interesting.
For $5 extra, a third-party lab would run his raw data through a database of research to see if he had a gene variant linked to disease. And the result came back positive. It told him he had a mutation linked to what's called Lynch syndrome, a genetic disorder that leads to potentially deadly cancers at an early age.
It was scary to think I might have something that I have to act on for the rest of my life. You know, it prompts all these questions. Do I have a low-level cancer now that I don't know about? I certainly would like to know more. I mean, at the time, it was very scary.
So in search of a Lynch syndrome expert, he went to Dr. Theo Ross, director of the Cancer Genetics Program at UT Southwestern.
Normally, when we get one of these tests, we just take them and put them in the shredder and do a real test, because we have to do a clinical test. That's what we do.
And the clinical test found Joshua did not have the potentially cancer-causing gene mutation that would have changed his life.
I was very relieved. You know, it obviously means I don't have to go through all those screenings. It meant that our plans to start a family didn't have to potentially change.
I think awareness of genetics is great, and that those companies, all of them have done a very good job of advertising that genetics is important. It's not a health test. It is not going to tell you about your predispositions to diseases.
Dr. Ross warns consumers don't realize their results from popular DNA kits are not conclusive. She says you should take them with
more than a grain of salt. Yeah, a bag of salt.
And that holds true even more so for people who come back with perfect results.
98% of people who don't have cancer but have one of these mutations and should be followed don't know that.
Joshua considers himself lucky.
I get in the car, drive 5 minutes, and I can get the definitive result. What about the people who live 3 hours from the nearest major medical center, who don't know who to contact?
But he hopes sharing his story will somehow help others.